Hi, I'm Dr. Stuart Menakar at the Palo Alto Medical Foundation Los Gatos Center. Welcome to Health Connections on KCAT television, Los Gatos, Monte Sereno. Today on the show, we're going to talk about skin care and other skin problems. Please welcome my colleague, Dr. Susie Butler from the Department of Dermatology.
Hi.
Nice to see you today.
Thank you.
Let's head upstairs. We're going to sit on the patio and have a little chat.
Okay, great.
Great. I'm happy to have Dr. Butler back on the show today. Today we're going to focus on her area of expertise in skin care, and that's really skin cancer. No one likes to think about having cancer, but fortunately for skin cancers, there's an awful lot we can do to help you. So Susie, not everyone who's watching the show today may have seen our last program. So we're going to talk mostly about skin cancer, but let's review some principles of prevention of skin cancer, like we did on our last show.
Sure. So the most common types of skin cancer have been all related to sun exposure. So I think the most important thing we can all do to prevent skin cancer is to protect ourselves from the sun. I think that means definitely wearing a broad spectrum sunscreen every day on our face and all the exposed areas, even backs of hands and the neck and ears, especially for men who might be exposing the tops of their ears. When you're outside, I think it's also really helpful to wear a very broad brimmed hat, maybe with even like a 3-inch brim is very helpful in keeping the sun off our face. Thinking about reflection also from snow or sand or water, if you're outside in those environments, I think it's helpful to protect all of those exposed areas. Using a lip balm with SPF is very helpful, and also just seeking shade, so being under an umbrella or a tree, and avoid being out during the really high peak hours of sun exposure between 10 a.m. and 4 p.m.
So Susie, I know there are many different kinds of skin cancer. Some are more worrisome, some less worrisome. Let's very briefly go through what kinds of skin cancers there are, and we'll go into a little bit more depth about each of them in just a moment.
Okay, sure. So the most common type of skin cancer is called a basal cell carcinoma, and that usually presents on the sun-exposed areas, so the face is the most common place for that to show up. And oftentimes it can just look almost like a hard pimple or a pink round bump. Sometimes it can get scabby or it can start bleeding just spontaneously when you're washing your face, so that's always sort of a warning sign. If some new growth is bleeding on its own, it's a good idea to get that checked. The second most common type of skin cancer is a squamous cell carcinoma. And that can also usually occur on the sun-exposed areas, although sometimes it can occur in the mouth or in the groin area or under the fingernails. And that can appear as sort of a red, scaly bump or patch. Also, oftentimes will bleed. It will look a little bit inflamed. Sometimes it can even look like a patch of eczema. So if it's sticking around, though, for several weeks, it would be a good idea to get that checked. And then sort of the most serious kind of common skin cancer is melanoma. And that is usually pigmented, although in rare cases it might not be pigmented. And that usually forms in moles, although sometimes it can just form in normal skin. And there are certain signs to look for when trying to identify a melanoma or when comparing a normal mole to a melanoma. So we sort of teach our patients this when they come in, call it the ABCDs of melanoma detection, but A is for asymmetry. So if a mole is not symmetric, and if one side doesn't look like the other, that can be concerning. B is for the border of a mole, so a mole should have a nice sharp border and not sort of be fuzzy or scalloped. C is for the color of a mole, so it's nice to have moles that are all one color, but when you start getting multiple colors or a very dark color, that can be concerning. And then D is for diameter. So we sometimes will say that if it's over 6 millimeters or the size of a pencil eraser, that should be checked, although there are a lot of moles that are bigger that are just fine, but this probably should be checked.
You've just talked about the A, B, C, D, and there's an E as well, but before we get into that, let's show some pictures.
Okay, sure. So this will be helpful to look at. So yeah, these are the sort of the things that we were just talking about. So as you can see, this mole is sort of not symmetric. This one has an irregular border. This one has multiple different colors, and this one is a larger mole. And you're right, the E is for evolving. So I think one of the most important clues when looking at a mole is if the patient has actually noticed if it's changing or not. So if you are looking at your skin and either you see a new mole or you see a changing mole that's gotten darker or bigger, that's a really important clue.
Susie, how about that mole that I've had on my arm since I was 6 years old and always got in trouble for picking at, and now I think it's a little bigger than it was when I was in elementary school?
Well, it's normal for moles to grow with you. So as you get bigger, your moles are going to get bigger. But if you see a sudden change in a mole where over the last 6 months it's doubled in size, or it's become inflamed, red, crusty, or if it's bleeding, those are the kinds of changes that we want to be aware of.
And there are some commonly held thoughts or myths about moles and what makes them bad. What if I have one of those witch's moles with a lot of hairs coming out of it?
That does not necessarily make it bad. Actually, if a mole is growing hair, that's sometimes a good sign. But a raised mole is not necessarily more worrisome than a flat mole. So they are both just need to be checked and monitored.
And then I hear patients ask me a lot about birthmarks. So some birthmarks are red marks on the skin, but a lot of patients worry about those big brown ones that are also sometimes hairy. Are those more likely to become cancer?
Well, there's all sorts of birthmarks, like you mentioned. So there's birthmarks made of blood vessels, which really don't have a potential to turn into melanoma. There are some people call birthmarks congenital moles, or moles that we were born with. And if those are above a certain size, then they do have a slight increased chance of forming a melanoma. So if they are bigger, then I would recommend getting them checked periodically.
Are there things that might be a precursor to developing a basal cell or other kinds of skin cancer that are a good warning sign that I can ask my doctor about and treat before they become cancer?
There are little lesions called precancers or actinic keratoses that we might find on sun-exposed skin, and they tend to look like just a little small patch of crusty or dry skin, oftentimes on the face or the scalp or the ears, and those are oftentimes precursors to squamous cell carcinoma. So if left untreated for a period of months to years, a certain percentage of those will go on to become a squamous cell carcinoma. So we typically do treat those. We can use cryotherapy, which is freezing them off with liquid nitrogen, or we can sometimes actually use creams that stimulate your body's immune system to get rid of those lesions.
And is that something I need to see a dermatologist for?
No, oftentimes your primary care physician can do that too. If you're getting a lot of them, it might be a good idea to have a yearly skin check by a dermatologist, because that does increase your risk for forming skin cancers. I see a couple little rough spots up here on your scalp that we may need to actually freeze off anyway, like a little guy right there.
Good.
And then, yeah, actually, can I freeze that? Is that okay?
Absolutely.
Okay,
Sure.
so I'm going to take
Help
the
yourself.
Okay, so I'm going to take a liquid
Just don't let
nitrogen.
your hair out or anything like
I
that.
will try not to.
That's right.
Okay. Let me see if we have any more. Actually, we have a little guy right here, okay?
Yep.
1, 2, 3. Behind it.
Yeah, it seems to develop.
I know, right where the sun hits. You doing okay?
Yeah. You can start anytime.
And then you have this one still. Did that one come back?
Good, yeah.
Okay, let me just do it. Maybe a little spot right here. So that is an example of a precancerous spot. I think that one's okay. Okay. Okay.
Well, let's talk about the most common kind of skin cancer, basal cell. You mentioned a little bit about it, but what else should our viewers know about this common kind of skin cancer?
Well, it's very treatable. So even though this is a skin cancer, it's very common and generally does not spread to any other parts of the body. It just stays right in the skin. But if left untreated, it can do some local destruction to the surrounding skin and nerves and even muscle and cartilage if it's left to grow. So I would recommend treating these. Generally, the treatment for basal cells is most typically a surgery. We will usually do that under just a local anesthesia, so you don't have to be put to sleep. We just inject some numbing medicine and then remove the skin cancer with a little margin of normal skin around it to get our clear margin, and then you just repair that area. And then that's usually it. The only other thing to know is that once you've had a basal cell, it does increase your risk for future skin cancers, both basal cell and other kinds of skin cancers. So once you've had one, we do recommend following up regularly with a dermatologist.
And how about squamous cell? How do we treat those kind of cancers?
Also usually with a surgical procedure, whether it be excision, which is just taking sort of the standard margin, which we typically would do on the body. If it's on the face, oftentimes we'll treat basal cells and squamous cells with a procedure called Mohs surgery.
Well, Susie, I know that you're an expert in Mohs surgery and you perform that procedure every week for our patients who need it. Tell us a little bit about it, please.
So Mohs micrographic surgery is a technique that we use when usually removing basal cells and squamous cells from the head and the neck. And the reason why it's effective is because it actually uses the microscope to sort of guide our surgery. We can remove the skin cancer in layers and check it under the microscope to make sure that the margins are clear before repairing that spot. So it is a little bit of a time-consuming process, but it's very accurate, and it actually has the highest cure rate of any of the procedures to treat skin cancer. It has about a 98.5% cure rate. And that also allows us to make the smallest defect possible, because we can sort of skinny the margins and just take what we need to, and we know that that'll be okay because we're going to check it under the microscope before we reconstruct the area. And so we would recommend that typically for skin cancers on the face.
And when you say defect, you mean remove the least amount of tissue possible.
Exactly.
So that things look really good even after the surgery.
Right, you will still have a scar, but I think with the Mohs procedure you'll have the smallest scar possible. Okay, so I understand you're here for the Mohs procedure today.
Yes, I do. Well, if you just leave my nose in one place that you could.
Okay. So what we're going to do is we're going to numb the area with some lidocaine, just like you had for the biopsy, and then we'll remove what we can see as the remaining skin cancer with a little margin around it of skin, and then we actually check it under the microscope while you wait. And then once we actually check it, if we see any more skin cancer that's left, we'll have to take a little bit more skin, just kind of like right here on your cheek. But once it's clear, then we will stitch the area closed and just kind of put some stitches in there. You'll probably have like a little line scar, right when we're done there.
Well, can you leave a big scar for me so I can say I was in a
Sure.
knife fight or something like that?
Okay, yeah. That definitely sounds great, yeah. Do you have any questions about what we talked about? Nice to see you.
Good.
And I will see you for the procedure, okay? All right, nice to see you. And we'll be in touch soon, okay?
Good.
All right. We're going right out here and then to the right there, yes.
Well, Susie, I think most of our viewers know, and you and I know, that the most serious type of skin cancer is called melanoma. It's the one we all worry about. I think there's good news, a little bit of bad news still, but a lot of good news about melanoma. But let's start and learn a little bit about it, and then get to how we treat it and the good news there, if you would.
Melanoma is a skin cancer that comes from the pigment cells in our body. So that usually comes from when a mole decides to transform into a melanoma, or sometimes it can just arise from the normal melanocytes that we have in our skin. And I think in general, melanoma is a very treatable skin cancer. It is becoming more and more common, so we want to get the message out there. And it's one of the most common actual cancers in young people, especially in their 20s. So it's definitely something to be aware of, but we are catching it earlier and earlier, and I think that's very important. It's important to catch the melanomas when they are still thin, and we have great treatments for that, and people generally do very well. If you have a melanoma, depending on certain factors of it, that will sort of dictate your treatment. But typically, the treatment would be a surgical excision of the melanoma with a margin of normal skin around it. And then once that's excised and the margins are clear, then we just sort of closely follow the patient with skin checks after that. But usually there's no additional treatment besides the surgery. So for those patients where their melanoma is a bit deeper and it possibly has spread to the lymph nodes or other areas, luckily we do have newer medications now that are much more effective than what we had in the past at treating metastatic melanoma. So we're very excited about that and hopeful that that's going to make a big difference for people.
It's a wonderful thing in my practice as a family doctor. I see a number of folks who've been treated by Dr. Butler or other dermatologists with melanoma. In the past, like when I was in medical school 100 years ago, we thought of melanoma as a uniformly fatal illness. But I have patients in my practice who've been under melanoma treatment and surveillance for 10 years or more now.
Definitely. I mean, especially now when I think we're keeping a closer eye on people and we're doing skin checks, we're catching melanoma earlier, and it's a very treatable condition. After that, we just kind of keep a close eye on people, but people do very well.
Susie, let's talk next about seborrheic keratosis.
Yes.
I know that that's a very common mole, and one that can look like everything from skin color to dark black, commonly confused with melanoma.
Yes, they are. Patients will often come in concerned about a new growth that they have on their body, and it turns out to be a seborrheic keratosis. They can look concerning. They're often larger in size, possibly darker in color. Oftentimes they'll sort of develop quickly and sort of have a peeling or kind of crumbly texture to them, so that's sort of one way we can distinguish them from actual moles. But the good news is they don't have to follow sort of the same rules as moles do, because they have no potential to turn into a skin cancer. So generally we just let them be. If they are irritating or rubbing on your clothes or itchy, sometimes we can remove them with freezing them off, but oftentimes we'll just let them be, because as my one of the people that trained me said they are barnacles on the ship of life. So we generally just leave them alone.
That's a great way to think about them.
Kind of look at your spots here on your arms, and what we're looking at is to make sure that everything has even borders and the pigmentation is nice and even. This looks like just a little seborrheic keratosis.
That's what I was going to call it.
And this spot here looks okay. That's
It
also
looks
a little
like
seborrheic keratosis. So if this is bothering you, we could always freeze it off.
Just when I see it, that's
Totally
all.
a benign growth.
Looks
so
like you're
that's
looking at a
good.
leopard or something like that. And then this one here you were talking about here. That,
Yeah, I want to take a look. So how long have you had this one, do you think?
I don't remember, but I know it.
Like a couple months, would you say?
Yeah.
Or? Okay. Does it ever itch?
Nope,
Okay. Take put this down just a little
never
bit.
paid attention to it.
Okay. Alright, so yeah. I think it just looks like a little benign growth that we can just leave there, or if you would like it.
It doesn't bother me at all.
Okay.
I get some dry skin on it every once in a while.
Okay. Yeah, I think everything else looks good. Okay. Alright.
Surely there must be times when we think there are skin troubles that aren't so bad, but it doesn't turn out that way.
Yes, we've definitely had instances where patients have come in for one reason or another. I had a patient last week actually that came in with a rash from a medication that he had started, and when examining the rash, I noticed a fairly wide melanoma actually on his back. So it was great that he came in and that we looked at his skin because we found it early and it was very thin and it's totally fine now. And sometimes the moles that don't look that concerning can sometimes be a skin cancer, but they just have noticed a little change in the mole. Maybe it looks more pink around the edges or getting slightly darker. So change is really an important factor that should prompt, I think, an evaluation.
So far today we've talked a lot about prevention with sunscreen and other methods, but patients ask me things about heredity in skin cancer and about those really bad sunburns they had when they were 6 years old at the beach. Does that play a role?
It definitely does, especially in melanoma. So we sort of know that the risk for melanoma is sort of multifactorial. So certainly sun exposure plays a role, but we also know that genetics play a role with melanoma as well. So if you have a first-degree relative, a sibling or a parent or a child with melanoma, then we do know that your risk is elevated for melanoma. Also, your skin type plays a role too. So people with red hair and freckles or very light skin and light eyes actually have an increased risk for melanoma. Also, if you have greater than 50 moles on your body, we know that that actually is a risk factor as well. Also, if you've had a history of an atypical mole, that also raises your risk for melanoma. So all of those things, if you have any of those risk factors, I would recommend getting a skin check annually by your dermatologist. Also, for basal cells and squamous cells, genetics does not play as much of a role, except maybe making you have a fairer skin type or a fair complexion. UV exposure is really the biggest risk factor for forming a basal cell or a squamous cell. So really it's cumulative exposure. The number of sunburns has definitely shown to increase your risk for melanoma, whereas your cumulative sun exposure is your biggest risk factor for basal cells and squamous cells. Also, people that are immunosuppressed, that maybe are transplant patients and are on medications that are suppressing their immune system, tend to form more skin cancers and more aggressive skin cancers. So we always want to see those people.
Do we see more skin cancers in patients taking chemotherapy for other types of cancer?
There are some chemotherapies though, even chemotherapies or medications that we take for melanoma and those kinds of things that actually can increase the risk of other types of skin cancer like squamous cells. So from that aspect, that's true. If you are on immunosuppressive medications, I think the important thing to know is just to see your dermatologist regularly or your primary physician regularly, and that we are aware of those risks and are keeping an eye on things closely.
Well, I want to thank you, Susie, for joining me today on Health Connections. I really appreciate you as a friend and a colleague. I think you do fabulous work. So for all of our viewers and patients of the Palo Alto Medical Foundation, I want to thank you as well for joining us today on Health Connections. Please remember not to be afraid of those moles. As Dr. Butler's told us, there are great treatments for all kinds of even dangerous moles, and it's much better to get things checked out and treated early. More importantly, don't forget prevention for your kids, your teens, and for yourself. From the Palo Alto Medical Foundation Los Gatos Center, I'm Dr. Stuart Menakar. Thank you for joining us today on Health Connections, KCAT Television, Los Gatos, Monte Sereno.